This is an ultrasound study of a 32 years old married female with a history of primary infertility for the last 3 years. And in front of you at present, what I'm showing you is the uterus with vagina, aligning the uterus and vagina both together. And here you can see that the uterus is normal in size. It measures approximately 7.9 centimeter by 3.3 centimeter. So this is the urinary bladder in longitudinal section. This is the vagina, this is the cervix, and this is the anterior myometrium, posterior myometrium. The endometrial canal is clear, and this is the transverse section of the uterus, weighing 4.8 is with the normal, and the area that you are seeing in this excuse me, I'm sorry. Okay, and this area, this area is the ovary. This one, let me show you. This is the ovary, right ovary. You can see follicular development in very early stage, and the ovary measures approximately 32 by 23 millimeters with a norm. No myometrial mass seen, fine, okay. Now as I move the probe anteriorly above the symphysis pubis eyebrow and then to the left side, we see a multiseptated cyst. These are two areas. Those two, you are seeing two cysts. This is cystic appearing area number 1. This is the cystic appearing area number 2. If this contains septa, suppose we don't see septa, it's a clear cyst, then which one will be the urinary bladder, or both are cysts? How we will come to know? You ask the patient to micturate, whichever the urinary bladder is will disappear, provided there is no UB pathology. Now this is the urinary bladder in this patient, and this is the cyst, that the pathology with numerous internal XY thin and thick septas. Okay, so no need in this case. This is the urinary bladder, and here on the left side, when I move the probe towards the left adnexa, I see this cystic area. If you want to study the cystic area, it is a now I'm going to it fulfills the definition of a cyst. See, it's thin walled, and you see the degree of posterior wall acoustic enhancement or strong back wall, this area. And internally, I have just told you, these are thread-like structures, linear, all thread-like structures. These are all septas within the cyst under study. Now, what note to note is that there is no calcification and no solid element within it. Neither there is any debris seen. This is the reverberation artifact, and when I will, the trick is that if I remove the pressure from the probe, it will disappear. Here it goes. When I give a little pressure, it appears. I remove the pressure, the reverberation artifact disappears. So, not a pathology. See the degree of okay. Now I'm going to give a sweep to the cyst, keeping it in the center of the screen, and you will see that it retains its shape. It does not change its shape. So all the criteria of a cyst is there. Why it is left-sided. See if there is any vascularity within, let us study. No vascularity is seen within the cyst, and as I move towards the left side, These are the iliac vessels on the left side. Just a minute. Okay. So the uterus here. This is the uterus in transverse section, and this. So this is a very typical hemorrhagic cyst or endometrioma, though there are two differentials for this, either endometrioma or a hemorrhagic cyst, and whereas the right ovary is normal, and she is suffering from primary infertility because of this, and so far C1 to 5 has not been performed. No one has advised so far in 3 years. So a very typical appearance of a hemorrhagic cyst. In fact, however, the possibility of endometrioma cannot be ruled out due to the age of the patient as well. And it is left-sided. This is the uterus. The uterus is normal by all parameters. And when I move the probe towards the anteriorly and left side, I come across the cystic area, and here you can see the iliac vessels or internal iliac vessel on the left side, because on the right side the vessels on the right side, these are the iliac vessels on the right side. This one. So this is our case of the day: hemorrhagic versus endometrioma. Hemorrhagic cyst versus endometrioma. Thank you. Utho beta.